Dr. Goodside. I work at Scheitelman Medical, and what we do is we do regenerative medicine. In order to get rid of all the questions about coronavirus, we have a plan in terms of bolstering the immune system. We supply B complex injections. We also do something called propolis, which enables your pharynx and your sinuses to be coated with propolis. And what that does is it prevents virus from coming into your system. It also prevents infections with bacteria and fungal infections. We've come to this through testing our own staff, and it seems to add an added layer of protection with masks. So we're not telling you not to use your mask. We're telling you that there's more ways to do it, to better seal your nasopharynx with what amounts to honey. Honey is antibacterial. We also use propolis for injections. It's a very useful material. Additionally, we encourage our patients to sit outside. The sunlight is full of UV light, and UV light denatures virus. That's the limit of what I'm going to talk about in terms of viral infections, coronavirus. We maintain social distancing. We encourage it, but for today, we're not discussing it anymore. What I do is I do regenerative medicine. Regenerative medicine is all about injecting growth factors, and the growth factors are in your blood. You also have inflammatory factors in your blood. Inflammatory factors are in the red cells and white cells. The growth factors are in the platelets and the plasma. We can spin your blood for about 10 or 15 minutes and separate the growth factors from the inflammatory factors. If we inject growth factors into a joint, it tends to heal it. I've been doing this type of treatment since 2001. And the reason I got into it is because I had significant lower back pain, I had significant neck pain, and bilateral shoulder pain. And I got this by playing lacrosse, and I was too small and too slow, and I got hurt a lot. And I found a group called the Osteopathic Prolotherapy and Regenerative Medicine Group, and I've been going to their conferences ever since 2001 when I got treated. And it's been a miracle. I had a broken collarbone on my right shoulder, and I had a lot of rotator cuff issues with it as well. And I haven't had pain in my right shoulder since my friend Walter Grote, who's a doctor in New Jersey, treated me at one of the conferences. Another doctor who treated me was Dr. John Sessions, who treated my cervical spine. And John Sessions has been doing this kind of treatment since the early 1960s. These doctors are all over the country. They're not mostly in New York or California. They're mostly in Texas, Missouri, and Tennessee, among other places. And this Middle America has made me aware that there's a lot more medicine in the hinterlands than perhaps anybody thought. Our office offers consults, free consults. I like to talk to patients face to face. And the reason I like to talk to them face to face is because their needs are pretty unique. No patient comes to me with the same exact problem as anybody else. So by talking to them and listening to them, I have more of a way of coming to a solution that they can live with. What we're not going to do on this this discussion is talk about, we're going to not talk about financial issues, because that's also personal. So if you have any questions about the cost or the treatment that has to do with the financial aspects of this, none of this is covered by insurance. The insurance companies know this works, but they don't want to pay for it.
Dr. Goodsight, we do have our first question. The first question is, in what areas can PRP help me with? So what areas of my body can PRP help me with?
Any joint that you have is a candidate for PRP. Ankles, knees, lower backs, elbows, wrists, shoulders, necks. My colleague John Sessions, who's from East Texas, is about 80 years old or 85 years old, and he's still doing this stuff. And he taught about 80 of us how to treat migraine headaches. And the experience has been, you treat it once and that's it, it's done. One patient I had who had a migraine headache kind of constantly after her motor vehicle accident, I treated it and she didn't even realize the headache was gone until I asked her about her headache. I had also treated her shoulders and her neck, and everything felt better, but she didn't even realize that her headache was gone. So that's the way headaches seem to work.
Got it. We do have two people that have asked, what is PRP? So what exactly is it?
The growth factors in your blood are primarily in platelets and plasma. The inflammatory factors are in the red cells and the white cells. And when we spin your blood, we can separate that. And PRP is platelet-rich plasma. Platelet-rich plasma injected into a joint are the growth factors. When your body gets inflamed, the purpose of the inflammation is to get the growth factors to what's broken. The nice thing about an injection is I can push it into precisely the place that is injured, and that makes it happen, and that makes the healing happen faster. And a lot of times when I treat, patients have a resolution of their discomfort because the inflammation has been, your body says, I have enough growth factors where I want them. And once that happens, the inflammation gets cut off. And it's not being done with anti-inflammatories, and it's not being done with corticosteroid shots. It's being done with your own blood.
I have another question, doctor. It says, how long does PRP last for?
Great question. In 2010, I was in a rollover car accident. In the rollover car accident, I broke 10 ribs, I broke my collarbone, and I broke my humerus, which is my shoulder bone, and I could not lift my arm. My colleague from Texas, Gerald Harris, injected my collarbone. I had what was called a non-union fracture, and that meant that the two fragments of my collarbone did not come together. At the time, I enjoyed lifting weights, and I couldn't do it because when the bones moved, the pain was just too excruciating. My colleague, Gerald Harris, injected the collarbone, and right in the space where the two pieces weren't coming together. And the magic was that a month after he did that, I was lifting about 150 pounds. That was 9 years ago. I had not had another treatment. I have had 5 patients who are AC repairmen. I'm not I don't lift heavy things anymore. I'm not a good example, even though I haven't been treated in 10 years for this shoulder pain. But the AC repairmen do heavy lifting. One came back after 5 years for a second treatment. A second one came back after a year. I treated his shoulders. When he came back, I treated his knees. He didn't come back for the shoulders. The answer is patients seem to do a 1 or 2 and done. Generally, when they come back in less than a month or in about 2 months, it's usually because they didn't get as much better as they wanted to get. It's not because things got worse again.
Doctor, I have a question from Sarah. It says, does PRP help with hip flexor pain?
The answer is the hip is a joint. If we push the growth factors into the joint, it will tend to make it relieve the pain. A lot of the inflammation is an attempt to fix something. That's why it hurts. The purpose is to get the growth factors there. That's your body trying to do what it's trying to do. I just do it faster. So yes, hips tend to feel significantly better after a treatment.
Very good. I have another question, Doctor, from Lori. It says, what is the downtime and will I have to miss work?
It depends what kind of job you do. I really like, when you come to my office, I follow you for the next 3 weeks. It's part of our plan. Our plan is that I am going to give you an exercise plan that will help you recover. And I want you to recover because I want your referrals. If you get better, I'm going to see your friends and family. I do not believe that it's a one and done kind of thing. There's a communal, we got to work together to make this work. And the way we do it is I kind of guide you through an exercise program. And the answer to the question about how you can go back to work right after I do it, I have some mixed martial artists who never listen to anything I say about rehab. And those guys are back in the training room, back working out 2 or 3 days after I treat. When I got treated, I treated my knee about 6 years ago, and I was on the treadmill 3 days later. I was on the treadmill actually the same day. I tell my patients to go for walks right after I treat them because I want more blood flow through the joint. And if there's more blood flow, there's more nutrition. If there's more nutrition, you're going to get better. In addition to that, in our office, I also do some nutritional counseling. I'm going to give you some supplements, and the supplements are going to help put more of the stuff your body needs to fix things in it. And if it's in it, you got a better shot at healing.
I have a question, Doctor, regarding the supplements. It says, what do the supplements do? How do they help?
The supplements we give out are collagen 1 and 3 and collagen 2. Collagen 2 is a precursor in your body for articular cartilage. The reason you're aging is because of something called osteoarthritis, which means that your cartilage is wearing out. That's why you're getting old. If you put more of the precursors, the things that make up the cartilage, in your blood, you got a better shot at them healing your joint. So the answer is, one of them is collagen 2. Collagen 2 precursor for cartilage. Collagen 1 and 3 is precursors for ligament, tendon, and skin. So if you put more of that in your blood, you have a better shot at getting those things to heal. So the answer is, and lastly, we want a multivitamin. Why a multivitamin? Because that helps your body utilize the collagens that we're putting into it. There are other ways to get it besides the supplements we advocate. The reason we advocate them is Neocell, which is a company that we use, makes materials that are very bioavailable to your body. So that's the supplements.
Doctor, I have a comment from Karen that says, my husband Dan is so impressed on his results with PRP, he now wants to do his other knee and shoulder. So Dan is treated with you in the past, now he wants to come back and see you for his knee and shoulder. So I would say thank you, Karen. Call us, come see us. We are definitely seeing patients.
And lastly, by all means come in. The consult is free always, even for my old patients. But the reason you want to come in for a consult is so we can make a plan. And the plan includes utilizing my able assistants who discuss the economics of doing what you want to do.
Perfect. We also have another comment from Michelle. Michelle says, my name is Michelle and I am a 73-year-old patient of Dr. Goodsight's for the past 10 months. In the past, I've had back and neck surgeries. She suffers from fibromyalgia. She has had both with you, Dr. Goodsight, via PRP and stem cell treatments. She says her pain has definitely decreased. I never knew about neural therapy until I met Dr. Goodsight. Let's see, she goes into more detail. Additionally, he has a fantastic staff. Thank you so much, Michelle. Let's see, and she's giving you a big compliment here, Doctor. She says, I have no questions. They've all been answered in the past 10 months that she's been your patient. She says that she trusts you without reservation, and she recommends for anybody watching that if they want to recover from pain issues, that you are the person to see.
So some of the things that Michelle, Ms. Holliday discussed is her fibromyalgia. What we are finding is that fibromyalgia very often is directly related to the sort of trauma that your body has absorbed from multiple surgeries. And what the surgeries do is they leave scars. And the scars are somehow very ingrained in your nervous system so that the pain seems to just kind of permeate from the scars. And what I have found is that treating scars tends to change the pain, the overall pain. And so what I've done with Michelle is treat the myriad of scars that she has on her body. And we've had very good success in helping her get past her discomfort. It has been very gratifying working with her. And one of the things you have to understand is it's working with the patient. It's not it's creating a treatment plan that the patient is totally involved with, because what's going on now in medicine is we're doing something called telemarketing and telemedicine, and we're trying to treat everybody in what's called evidence-based, which is basically statistical, and we're trying to treat everybody the same way. And if you don't fit the statistics, you don't feel better. And okay.
Doctor, we have about 5 more minutes here, and I have another question. It says, how soon can I make an appointment? How soon can I get an appointment with you?
If you call the office, you can speak with my able assistant, either Vivian or Sherelle, and both of them will schedule you. I like talking to patients. This is part of, I figured I could talk to more of you at once this way. Honestly, it's not the same as talking directly to one person. So I really encourage you to call our office, make an appointment. The first appointment is on me. It's a free consult. It will enable me to understand you better and help you to understand me better. So there's no reason not to come in ASAP. Bye. And thank you for joining me today.